We expect to see a number of key pieces of healthcare legislation in 2018. So, of course, last year in 2017, we saw a number of ultimately failed attempts by congressional Republicans to repeal and replace the Affordable Care Act. We don't expect Congress to tackle the Affordable Care Act on a large-scale level in 2018, but we do expect to see some actions on more tailored pieces of the Affordable Care Act. Namely, we expect Congress to try to either delay or repeal the medical device excise tax, as well as the health insurance tax. And we also expect Congress to try to take some action on the Cadillac tax, which is the excise tax on high-cost employer health plans. Repealing or delaying the Cadillac tax has bipartisan support. The law is currently scheduled to go into place in 2020, but of course employers need to negotiate health benefits in advance, and so I believe that Congress understands they need to take action this year if they're going to address that.